Good evening, Facebook. So today is day 11 of my mental health awareness challenge. And as you know, I was nominated by my friend Victoria Lawrence to take on this challenge. And I still have 14 days to go. Each of the last days I've been sharing tips on maintaining optimal mental health and also tips on helping people to also tips on helping those who are living with mental health conditions. So today I'm on letter H. That's H for Holland or H for hotel, and I'm going to be talking about help and mental health in terms of what help is available for those who have mental health conditions. And that's a very important topic in my view because one of the reasons why sometimes people don't access help is because they don't even know what's available. And so it's important to really outline the sort of help that is available. Talking about what happens in the UK, as I've said in the previous videos, that the GP is always the first port of call if somebody is experiencing mental health conditions. However, the other thing to mention is that having a mental health condition is not a lifelong sentence. Some people think that um, it's not always the case that people who have mental health conditions are going to have a lifelong long experience of it. We do know, for instance, that only that 50% of those who have a first episode of depression would have a second episode. However, there's the 50% who never experience that episode again. And it's about sometimes the crucial bit is about the way the first episode of that depression was managed. So there are treatable mental health conditions. For instance, there are conditions that people actually fully recover from. So it's important to bear that in mind. So in terms of help, what's available? To start with, if you lived in the UK and you went to your GP with a mental health condition, what the GP will usually do will be to take a history and assess whether the situation is such that it can be managed in the GP practice. Most mental health conditions are managed by general practitioners in the UK. It's only the severe form of mental health conditions that go to what we call the secondary mental health services, which are the specialist mental health services, the type of service that I work in. And so the GP can then discuss options after they've taken a history, asking the person about what symptoms they are getting. They will then carry out an assessment they will then discuss options. The options could range from talking therapies, which is usually provided also. It could be provided via the GP practice. The common one is cognitive behavioral therapy. They could also they could also discuss the option of counseling, for instance, which is just finding somebody who is a professional whom you can speak to in a very confidential way and get things off your chest. In addition to that, they might also then recommend medication, and there are a number of medications that are recommended. Antidepressants are the common ones for depression. However, it's important to bear in mind also that prescribing antidepressants is not a life sentence. Usually, when people start antidepressants for a depressive episode, they are expected to stay on it for a 6 to 9 month period after their symptoms have resolved. And the reason for that is we know that people who stay on antidepressant medication, who consistently use it even after their symptoms have resolved, for a 6 to 9 month period, carry less risk of having a relapse. So people have several misinformation or erroneous beliefs about antidepressants. Some people think it's going to make them feel like zombies, but the reality is that these days there are several antidepressants, and there is always one that will suit the person's needs. The other medications that people prescribe, usually antipsychotics, are prescribed when there is a mental breakdown, and that's commonly done not by GPs but by secondary mental services, specialist mental services in the UK. So talking about medication, the thing to say really is that even though medication might be associated with side effects, be reassured that there is always one out there that should suit your needs, that should help you. And people do think that medication will make their conditions worse. That's not the case. Some people say, oh, if they start medication, then the condition will be worse. And do also bear in mind that there are some conditions that would not really improve without medication being combined with talking therapies. So we've talked about talking therapies. Talking therapies, there's cognitive behavioral therapy, like I said. Cognitive behavioral therapy is really about helping people to understand how their thoughts are linked to their mood or their emotions, and their emotions are in turn linked to behavior. And that's a cycle that then repeats itself. Mood, so it's thought, mood, cycle, thought, mood, behavior, behavior, thought, mood, behavior again. So it's important to, and what behavioral therapists, cognitive behavioral therapists help people to do is to make the links between their thoughts and to identify rogue thoughts that actually set them on a negative emotional path and also cause negative behavior, and to nip those thoughts in the bud, to challenge them, to rationalize them, and to change them, to replace them. So that's what cognitive behavioral counseling, like I said, is really about speaking to a professional who is non-judgmental, who is going to help people to get things off their chest, and who is just going to be like a confident. And of course, there are other forms of talking therapies that are available via secondary or professional specialist mental services. In all the other services that secondary mental service or the other professionals that work in secondary mental services that also provide support are psychologists, for instance. We have psychologists that provide different forms of therapies. We also have occupational therapists that help people with mental conditions to be able to regain their skills, regain their activity of daily living skills. When people have mental problems, sometimes it affects their confidence in carrying out their normal daily tasks, like cooking, like even washing themselves, or like going shopping, like engaging in social activities. And so occupational therapists can help people to regain the confidence and the skills to do that again. We also have vocational therapists, people who help those who have suffered from mental health conditions to actually return to work. They could help people to gain skills. They could signpost them to sources of help where there's free courses, for instance, or places where they could volunteer. So because we do know that work is a very important thing in recovery from mental health conditions. And when we get as far as W, I'm going to be talking about work and mental health and how that impacts the interplay between work and mental health. So staying with help for today. So those are the type of professionals that get involved and that the type of help that is available. Also, we sometimes have people in mental health services who can support those who have the condition in terms of helping them to organize their benefits, helping them to apply for the benefits that they need to support them. Those are because sometimes with mental health conditions, it's difficult to be able to go through all the paperwork, to be able to negotiate all the ins and outs of applying for benefits. But those are things that can also be done if one has a severe mental health condition or one is referred to secondary mental health services. And those are the type of support that is available. So really the way I want to conclude tonight again on help and mental health is that please do seek for help because there's help available. It's not true that there is no help available, and it's not true that mental problems are necessarily things that people live with for the entire period of their lives. There are people, there are treatable conditions, and full and recovery is possible. So thank you once again for listening. Please do share experiences. Please do share thoughts. Perhaps some people have had mental health help in the past and they found it helpful. Sharing those thoughts can help other people who are currently unsure about what to do to actually ask for the help that will help them to get better. So once again, I look forward to being with you tomorrow, and thank you for listening. Please let's get the conversation going. Bye for now.